2011, my family got worried about me because of some of the symptoms that I was having. Some of the symptoms that I was having back in 2010 was major weight loss. I was tired all the time. I had tremors in my hands. I was always cold when it was hot and hot when it was cold. At this time, my family informed me to go see the doctor to see what was going on with me. Come to find out that I was diagnosed with hyperthyroidism. Today, I am going to inform you about the different types of thyroid disease. The first type of thyroid disease that I'm going to talk about is hyperthyroidism, which is also known as Graves' disease. Hyperthyroidism produces too much hormones for the body and works too fast for the body. It's uncontrollable no matter what you do. The only way that you can control hyperthyroidism is if you seek medical attention. Some of the symptoms included with hyperthyroidism are weight loss, rapid heartbeat, tremors in the fingers and the hands. You're always tired. You lose a lot of weight no matter what you eat, even without exercise. The doctor then prescribes anti-thyroid medications. You can only be on the anti-thyroid medications for up to 1 year. After that, you go seek a specialist, a thyroid specialist. Then the specialist measures your thyroid, looks into your thyroid more, then determines whether or not you're going to need surgery or radiation therapy. Radiation therapy is when it's done at the hospital. There, they measure your thyroid and find out to see how much dosage you need in order to get rid of the thyroid. Tests are done after 2 months of having the thyroid radiation therapy. You go back to your doctor to see if it worked. If it didn't work, if your thyroid's still in place and it didn't work, you have to go back for another treatment. 90% of the time, the radiation therapy should work the second time. If this doesn't happen, you then have to go back, and the last thing after 2 radiation therapies, the last resort would have to be surgery in order for you to remove your thyroid. This is only because your thyroid is still producing too many hormones and it's not good for the body. Next, we're going to get into hypothyroidism. Hypothyroidism is the opposite of hyperthyroidism. Hypothyroidism does not make enough hormones for the body. Hypothyroidism is caused by a disease called U.S. Hashimoto, which is an autoimmune disease that attacks the thyroid by mistake. Hypothyroidism is caused by hyperthyroid radiation. As soon as you get rid of your hyperthyroidism, you're automatically going to turn to hypothyroid. Thyroid removal is also another cause of hypothyroidism. So as soon as you get rid of hyperthyroidism and as soon as you get rid of your thyroid, automatically turns to hypothyroidism. At this point, you're going to have to take medication for the rest of your life to provide hormones for the body that have been taken away due to the fact that you don't have the thyroid anymore. The doctor then prescribes you levothyroxine. It's a little pill that you're going to have to take for the rest of your life, and this pill is prescribed to you depending on how much you weigh. Depending on how much you weigh, the doctor then knows how much levothyroxine to prescribe you. This medication is to be taken on an empty stomach so your body can digest it every morning for the rest of your life. Some of the symptoms of hypothyroidism are weight gain. Even if you exercise, it's very difficult for you to lose the weight. Depression, fatigue, dry skin, and a hoarse voice. Also, another symptom is being sensitive to the coldness. According to the American Thyroid Association, more than 12% will develop a thyroid disease in their life. An estimated 20 million will contract the disease in their life. 60% are unaware that they have the disease. This is why you must go get checked with your doctor. You have to get tested for it. The main difference between hyperthyroidism and hypothyroidism are the symptoms. For the hypothyroidism, like I said, the metabolism works too fast and you lose weight so fast. hypothyroidism is hard to lose weight no matter what you do. The fact sheet, according to the hypothyroidism fact sheet, to be on the safe side, make sure that you get tested so that your body can function properly and you can live comfortably the rest of your life. Like I said, back in 2011, I was diagnosed with hyperthyroidism. After all the treatments and 2 radiation therapies that I went through, I am now hypothyroidism. This is when my doctor prescribed me levothyroxine.